Good evening and welcome to another edition of our COVID-19 pandemic update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Walker. Here are some of the highlights this hour. Today, Presidential Task Force identifies homegrown solution to coronavirus subjected to further clinical verification. National Human Rights Commission enlightens public on COVID-19 patients' rights in treatment centers. And EU Commission proposes €750 billion recovery fund. Now, as the coronavirus numbers increases, the race to find a vaccine or other solution to the virus intensifies. Nigeria seems to be making progress as the Presidential Task Force on COVID-19 says it has identified 3 out of the numerous claims to solutions on the coronavirus, and they are subjecting it to further clinical evaluation. On our theme today, we'll be assessing the efforts by the NCDC and the Presidential Task Force to finding a homegrown solution to COVID-19. But first, let's begin with the focus, and that is Lagos, Nigeria's commercial nerve center. Since the virus began, Lagos has stayed the epicenter with 3,756 of the total cases of COVID-19 across the country. With the projection of more cases in the coming days, the Lagos state government and the relevant agencies continue to give the assurance that the state is fighting a good fight and there is no cause for alarm. But let's look at the merits of the assurances, which is also coming as a result of out of the total individuals infected and those that have died in Lagos, 3,051 of them are currently on admission. And so far, the state has discharged 658 of them, and that is the highest in the country. When you also look at the progression of the virus in the last 3 months and what the situation has been projected, it looks like the next 3 months, that is, going by these milestones from the 27th of March, where we had 44 confirmed cases. We didn't have any fatality. But then we saw things skyrocket. A month later, April 27th, we had lost 19 people out of 764 confirmed cases. And as at today, you know the figures. The Commissioner for Health in Lagos State, Dr. Akinbayemi, made further projections that by July's end of this year, we should have between 90,000 to 120,000 cases, which is about an average of 200 to 300 per day. We have not reached our peak, we're being told, and he maintains that a gradual rise, not astronomical, a sudden spike not expected, but more testing capacity, and meaning that we will see more cases. Let's look at what Lagos is doing to keep the virus under control. And one is rapidly collecting tests, samples, decentralizing sample collection centers across 20 local government areas, expanding its capacity, labs running 24/7. Currently, there are 8 isolation centers in Lagos. More also as to what Lagos State is doing in terms of the isolation center spread across the state. However, 2 special centers at first, and that's the cardiology hospital in Ikoyi, and there's also another special center, and that is the one in Lekki, adding to the number of isolation center that the state has in these areas, in Ikoyi Stadium, Etiosa, Luth, Idiaraba, and the others. Still looking at what Lagos is doing, it's talked about the availability of bed spaces. So what exactly does it have? What is it working with the numbers that it has? With its NCDC figures of active cases at over 3,000 patients, the Commissioner for Health at a briefing recently said that the current bed utilization is somewhere between 60 and 70%, and there are plans to scale up bed capacities. It's also adopting the home-based care as an option to meet shortage of available bed spaces. And we have been talking about the measures it is taking on that. Still staying with Professor Abayemi in Lagos, he says there is no cause for alarm despite the rising cases based on empirical data measuring the impact of the virus on leg oceans. And we're looking at 80% of those who contract COVID-19 having mild or asymptomatic cases, 10% are moderately unwell, and while we have a 10% for those with severe symptoms. Research is still on to further understand the impact of the virus on citizens. Well, compared to other states, the prognosis for Lagos in handling the virus is promising, according to experts. But compared to its population and the speed of testing, there appears to be still a lot more that is to be desired. Well, let's go over to what the NCDC is saying and talking about the figures coming in today. 8,344 cases. These are the total confirmed cases in Nigeria. 2,385 cases have been discharged, and we're having the death toll at 249. The latest cases, 276, were reported in 15 states. That's according to data from the Nigeria Center for Disease Control. A breakdown of the figures by region shows that Lagos in the southwest still has the highest number, followed by Kano in the northwest with 923 cases. The FCT in the north central region maintains the third highest tally in the country with 519 cases. Borno leads in the northeast with 256. We have Edo State in the south with 218. Ebonyi now leads in the southeast with 36 confirmed cases. The Presidential Task Force on COVID-19 returned today after the Eid al-Fitr holiday with news that the Ministry of Health has identified what it calls 3 local solutions to the coronavirus. Briefing the media today in Abuja, the Secretary to the Government of the Federation, Mr. Boss Mustafa, says, however, that the claims will be further subjected to clinical trials.
Other patients. This year's Eid was celebrated further reminds us that we are living in unusual times occasioned by the COVID-19 pandemic, thus bringing out the need to strengthen our resolve, to change our behavior, and get attuned to new ways of life, because what we used to know as normal has been permanently changed. The Presidential Task Force observed activities nationwide, and reports received were mixed. We, however, remain committed to the pursuit of strategies that would promote our well-being and channel resources towards efforts that would guarantee we overcome this pandemic while limiting its negative effects on our individual and collective survival. Today, the 27th May 2020, is also Children's Day worldwide, and this brings to mind the need to build a legacy that will guarantee a safe and secured future for our children. Prior to the COVID-19 pandemic, the nation was faced with the challenge of out-of-school children, estimating about 12 million. This has now been compounded by the compelling need for closure of schools as part of the measures to limit the spread of the virus. The Presidential Task Force has been deliberating on this situation and wish to inform Nigerians that the Federal Ministry of Education will roll out measures to be put in place for safe reopening of our schools. As a measure of the importance attached to research and development of local capacity for finding a cure for COVID-19, the Federal Ministry of Health held a virtual meeting with a number of researchers and scientists with claims to cure of COVID-19. And out of the numerous claimants, 3 were found to deserve further investigation and have been forwarded to the relevant authorities for appropriate review.
Now, the head of Prevention Programs and Knowledge Management Department with the Nigeria Center for Disease Control, NCDC, Dr. Chinwe Ochu, joins us from our Abuja studios on more of this, especially the homegrown solutions we're hearing. We'd like to welcome you to the program. To begin with, the promise of a homegrown solution coming from Nigeria. What more can you tell us about it?
Thank you very much for having me. Well, let me start by joining the PTF to congratulate our children on a successful celebration of Children's Day in very difficult situations. Now, back to your question. Well, we know that this is a novel virus, and a lot of research activities are going on in various countries of the world to identify especially a candidate therapeutic of choice for managing COVID-19. So Nigeria is not left behind. We have scientists, we have people that are also working to see if there are some of these homegrown products that could be effective in managing COVID-19. So what the PTF is saying, and we heard the SGF say, is that the federal government is looking into these products. And there are 3 of them now that look promising and have been channeled to the relevant agencies for testing. NCDC is not one of those agencies, but we have NIPRID, National Institute of Pharmaceutical Research and Development. NAFDAC is also there. So I'm aware that there are protocols in place to be able to validate, evaluate and validate these claims on this drug, just to be sure that whatever is coming out is safe for Nigerians to take, does what it is promises to do, and does not cause harm.
Dr. Ochu, now the NCDC, we understand, is leading the National COVID-19 Emergency Operations Center across states in Nigeria. But for states like Lagos, the FCT, Ogun, at the beginning, it seemed there was a lot of concentration of testing in those states. And over time, the molecular laboratories, 28 of them now, were established, spread across the Federation. Well, people want to know how much testing is ongoing in other states like Taraba, for example, Ebonyi, or even Borno State.
Okay, let me start by saying that we have improved our testing capacity as a country. At the outset, we started with just 5 molecular testing laboratories, but currently we have 28 molecular testing laboratories in various states, specifically 19 states of the Federation in the 6 geopolitical zones. Now, the testing capacity we have currently, we can test 2,500 samples on a daily basis. That is the capacity we have across the country. But it is the states that collect the samples, and the samples get to the labs for testing. So, and there is variation in the number of samples that states have been collecting, and that determines the number of tests that are also run. So it varies from Lagos, that has tested over 3,000, to states that have even tested just below 10. So the capacity varies per state, and it's all dependent on the number of samples each state is able to collect for testing.
How would you respond to some who feel there isn't a lot of transparency at the state level to the COVID-19?
Conspiracy?
More like those who feel there's not enough transparency in activities of government to the spread of the virus, to the surveillance, to containing the spread.
Well, let me say here that the response to this outbreak is driven at the state level, because that is where we see the cases occurring. And a lot of states have shown a lot of commitment. And that is why we have, on a daily basis, data being released from these states on the number of cases that have been detected. So I think there's also need for Nigerians to have a significant level of trust to be able to, work closely with the states. Because when we are talking about the states, it's not just the state government. We also have individuals in the state who have a role to play. So this is an outbreak that everyone has a role to play, including the Nigerian that is out there on the street. It has a role to play in adhering and complying to constituted guidelines, making sure you stay safe. So I don't think this is the time for anybody to start pointing fingers, blaming others, but rather to ask ourselves this question: what can I do? What role can I play? What is my part in all this? So that together we can see the end of this outbreak.
Indeed. We'd like to thank you. We appreciate your time on the program, the Head Prevention Programs and Knowledge Management Department with the NCDC. Thank you so much, Dr. Chinua Ochu, for joining us.
Thank you very much.
Still to come on our COVID-19 updates, we have the Executive Director of the NHRC on the rights of COVID-19 patients at treatment centres. That's in a moment. And different states continue to adopt varying measures to curbing the spread of the coronavirus pandemic. We begin in Ogun State, where the chapter of the NLC, the state's chapter that is, has inaugurated a 9-member organised labour civil society situation room on COVID-19 to engage the state government on how best to gradually and systematically begin to reopen the state's economy, protect workers' income. The state chairman, Mr. Emmanuel Bankole, believes that synergy will effectively combat the pandemic, especially as if it's replicated in all the 20 local government areas of the state. A coalition of labour unions in Kano under the Nigeria Labour Congress is set to begin a 14-day warning strike following the state government's alleged deduction of workers' salaries. At a news conference, the NLC chairman in Kano, Mr. Kabiru Menjibir, says the action of the Kano state government is contrary to Convention 95 of the International Labour Organization, which Nigeria is signatory to. And finally, Ondo State government has lifted the ban on religious gatherings in churches and mosques in the state. According to the governor, churches will only operate on Sundays, while mosques will open for worship only on Fridays. Mr. Akeredolu, however, emphasized that all the precautionary measures against the spread of COVID-19, such as the use of face masks, social distancing, be strictly observed. And the National Human Rights Commission is creating awareness on the rights of patients at different isolation centres across the country. The Executive Secretary of the Commission, Mr. Anthony Ojukwu, lists 8 rights under the guidelines to include, you can see on your screen, the right to adequate and timely medical information, the right to equality and non-discrimination in treatment, the right to dignity of human person, the right to mental well-being of patients and staff of treatment centres, the right to access of adequate accommodation, food, water in the centres, the right of access to information, communication in the centre, the right to privacy and confidentiality, not forgetting the last right to religious observance within the protocols of physical distancing. Well, to talk more about these rights is the Executive Secretary himself of the National Human Rights Commission, NHRC, Mr. Tony Ojukwu. We'd like to thank you for joining us. He joins us from our Abuja studios. So let's begin with, are these guidelines justiciable? Can you sue any government agency, hospital or person who has breached any of the rights?
Thank you very much. I'm happy to be here once again to talk about the rights of COVID-19 patients. You will agree with me that the rights are not strange rights. They are all rights contained in the Constitution of the Federal Republic of Nigeria, to which every Nigerian is entitled to pursue his rights, either in court and also if such rights come to the Commission by the mandate of the Commission, they are enforceable. So those rights are not strange rights. They are the same rights in the Constitution and under the African Charter on Human and People's Rights. They are all existing rights of Nigerians.
So how does the Commission plan to monitor all the isolation centres? And this is also considering some of the precautions that, as a Commission, you also be taking in this regard.
Well, in this COVID-19 pandemic period, we have to find very innovative ways to do our work, part of which is monitoring of human rights violations. So the strategy we have is not to use physical presence in the isolation centers, in the treatment centers, due to the contagious nature of the disease. Now, we intend to use a mobile app. This app, we're working on it presently. It is going to be an extension of the app we use to monitor human rights violations. So there's going to be a section for COVID-19 patients, and all the patients will be able to access this app and follow the questions that will highlight whether any of these rights are being violated, whether they have access to water, whether they have access to accommodation, whether they are given medical information as they may require, whether they are being discriminated against, whether they are being treated humanely, whether their mental situation is addressed psychologically, and so on and so forth, whether those of them there have a right to do their worship within the protocols. So that app will be able to ask patients to state how the centers are being run. Are the children separated from adults, for instance? Is there provision for persons with disabilities? Do they have the necessary things? The older persons in the centers, are they given assistive aids to be able to cope with the center? The whole app will be able to assess the situation to see whether human rights is adequately mainstreamed into the way the centers are being run. And with that, we should be able to get a report to have an insight into what is happening in the centers.
Right, we look forward to that report. We would like to thank you, the Executive Secretary of the NHRC. Thank you so much, Mr. Tony Ojukwu. Thank you for joining us.
Thank you very much for having me.
May 27th every year is celebrated in Nigeria in honor of children in the country. Apart from the celebration, it's also a time to highlight the issues surrounding their upbringing as well as promote their rights to proper development. In 1925, the International Children's Day was first proclaimed in Geneva. All Channels Television went round Lagos today, and these are some of the sights and sounds from our children. Happy Children's Day to everyone. Well, a major recovery fund worth 750 billion euros has been proposed by the EU's Executive Commission, and this is to help the EU tackle an unprecedented crisis. The package will be made up of grants loans for every EU member state. Economies across 27-nation EU bloc have been ravaged by the COVID-19 pandemic, but several southern states had big debts even before the crisis. Commission President Ursula von der Leyen said this is Europe's moment. She told the European Parliament that things taken for granted are being questioned, and none of that can be fixed by any single country alone. The NCDC continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory. Also, the World Health Organization's website, Each Moment, keeps you updated about the spread of the pandemic. The strategy on their website also guides public health response at both national and subnational levels. You can take a closer look at the numbers in real time. Well, that's our COVID-19 special edition on Channels Television in collaboration with the Ford Foundation. Thank you for watching. Of course, our website, channelstv.com, has the latest information. Join us then. Until next time, don't forget, wash your hands and wear your face masks.